Welcome back, everyone, and I hope you had a nice break, managed to stretch your legs, get some fresh air, maybe a little bit to eat, a cup of coffee. Welcome back on behalf of CDAC to part 2 of CDAC's 2020 Annual Public Forum this year under the title Accountability in the Age of the Algorithm, Championing Pathways to Inclusion in Tech-Driven Futures. Just before we get started, a reminder about questions and comments on the Eventia platform. This is where we can ask you to put all of your questions and comments during the sessions. We'll be putting your questions to the speakers at the end of each session during the plenary sessions. And we also ask that all questions are put here and not directly into Zoom if possible. And we got a lot of questions during the last plenary. I didn't manage to get to all of them, but we will try to weave them into later discussions, and certainly we'll try to address them in a blog post or something similar post-event. We encourage all social media engagement. You can tweet about what you're hearing and share about what you're hearing or thinking using the following hashtags and Twitter handles. CDAC 2020 is the hashtag to use for this two-day public forum. And just to remind you that all the sessions of the public forum are being recorded and will be shown on and available on CDAC's YouTube channel after the event. And finally, the event organizers, MYT, are here to help you with any technical difficulties. So please use the questions and comments facility with the virtual meeting platform to ask any technical questions, or just email the team directly and the email that's shown there, meetings@myt.uk.com, where they will be very happy to support and respond. So now we're moving on to the second theme of the forum, the digital ecosystem. I'm delighted to introduce the next session, which is titled, How Can We Enable New Power to Flourish in the Humanitarian Ecosystem? This session was pre-recorded for us by Loop. So without further ado, I'd like Geoffrey Kateregga and Salama Bakhalah to take us away. Thank you.
Welcome everyone to the session on Loop. My name is Salama Bakhalah. I'm one of the board members for Loop. Our main work is around feedback mechanism and ensuring that people have a platform where they can provide feedback around the aid assistance that they receive. Within the last years, there have been a lot of commitments from the organizational sector regarding feedback, and there have been a lot of investments. However, what Loop wants to bring into this is to ensure that that feedback is not lost, especially if it is collated from different sources. And the other part is that making sure that everyone actually have a chance to provide feedback. For example, you have 5 organizations in area X with different feedback mechanism. A service user could be receiving aid from 2, 3, or even all of the 5. If they're using different feedback mechanism, that person would be expected to be able to provide feedback in 4, 5 different ways and means. And in context where there is no access due to, like now with COVID or conflict, for me, simply Loop is about making sure that the system works towards what the people want and use what the people want to make it happen, and not the other way around, and not expect that the service user or the person or whoever is on the other end of that to adapt to what the system is about. Thank you for your time, everyone. I'll hand over now to Geoffrey, who's also a board member in Loop. Geoffrey would be talking about risks and opportunities within the sector and where Loop can play a role in that.
So yeah, my name is Geoffrey Kateregga. I work with the Humanitarian OpenStreetMap team, and I'm the president of our Loop. I'm based in Kampala, Uganda. So yeah, if you see where I am, it's a bit dark. That's because the power has just currently gone off. So yeah, those are some of the challenges we face here, and it tells you the local context here a little bit. In the loop, we are trying to use centered design, and the idea is just around, designing a solution that is in the hands of the people, because we believe we need to balance the power a little bit. So put people at the center of the use of the data. They have to own the data and use the data to design solutions that meet their needs. From place to place, there are different contexts in terms of like what technology is local available, what people are using. So we try to adapt our loop in the technology that people use. So for example, in the Philippines, people more use social media like Facebook. So we want them to be able to give feedback through such a platform. Whereas if you go to Zambia, people are likely to give more feedback using a computer or a mobile phone. So I want to try to fit the local context and allow people to give feedback using the technology that is really available for them to use. The other one is, data protection, because if someone is giving feedback, they want to, feel that they have a safe space where they can give their feedback, and the feedback they give is not going to, to act against them, be it like losing an opportunity they had or even a job. So like it should be able to give people like that kind of freedom where they can feel free to share. And I think the other one that is very important is also real-time monitoring for things like rumors and questions. For example, right now in the COVID situation in Uganda, where I am, there is a lot of false information that comes out. So if it is a real-time platform, then it can, when someone asks a question, other people can be able to give real-time feedback, and if it is wrong information, then they will be able to correct the person and give facts and right information, so that at least before the wrong information spreads, it's been resolved there and then. So real-time monitoring to prevent misinformation is an opportunity through such a system. So yeah, we all know that access to technology is not uniform everywhere. Fewer people have access to mobile phones, especially in Africa, like in Uganda where I come. So if you design a system where people can only give feedback using a computer or a smartphone, then there are people who have like normal phones. People should be able to give feedback using like USSD codes, and that should integrate in other platforms, and should be two-way. If someone gives feedback using a normal mobile phone, they should be able to receive also feedback on what they reported on in the same way. So it shouldn't be just one way, but two ways. And I think the other thing to mention is also on things like gender, because sometimes you find more men have access to technology than women. So how do you also make it like gender, to make sure you can reach out to more women as well, because some of the crisis mostly affects women. So designing something that tries to solve that kind of a challenge is very important. We're trying to put power in the hands of the people. So we feel like feedback should be in the hands of the people, where power structures are not at play, where everyone can freely come out and give feedback, especially because most of the aid is supposed to help people. So if you don't put people at the center of giving feedback on what they're receiving, then I don't think it's a level playing field. So to make it more open and more accessible to everyone to be able to give feedback. Yeah, so thank you so much, everyone, for listening to me, and thank you so much, CDAC, for putting together this wonderful event where we are able to share about the work we do in the feedback loop mechanisms. Thank you.
Thank you so much, Geoffrey and Salama, for giving us a flavor of Loop. We'll definitely be checking it out. It looks really great, and it'd be great to also learn from you how you've dealt with issues like data governance and how the community is guiding the development of the platform. That would be really interesting. So thank you very much, and hopefully we'll see you in the plenary afterwards. I'd like to now introduce an issue that is very familiar to all of us, globally topical and all absorbing right now. And the reason that we're here gathered virtually rather than mingling in a venue in Geneva or being live streamed from Geneva, perhaps from Jakarta next year, Adelina. And that is, of course, COVID-19, reaching the most vulnerable in a time of social distance. It is a question that all humanitarian practitioners are asking themselves right now. And I'm delighted to introduce the next panel, which will be led by Meghann Rhynard-Geil, the Humanitarian Director of Internews, who will introduce her panel. Meghann, the mic is yours.
Thanks so much, Paul. I'm really excited to be here. So let me just share my screen quickly, and then we can get started. All right, well, yeah, thank you again so much for having us. We're really excited to be discussing this challenge and opportunity that we've seen with COVID. So I'm joined today by Irene Scott, who's the Global Project Director for our Rooted in Trust program that's supported by the Bureau for Humanitarian Assistance. And then two of our partners. So Abdul Mujeeb Khalvatgar, who's working for NAI, which is a media development and support organization in Afghanistan. And then Ellie Kemp, who's the head of crisis response at Translators Without Borders, an organization that aims to close the language gap in humanitarian crises. So yeah, today we'll be discussing basically what our creative solutions have been to trying to reach vulnerable populations during the time of COVID, and what some of the challenges are that we've experienced as well. I think something we've all experienced is kind of isolation, particularly as we've all moved to remote work. And so something that we've really been prioritizing, especially in this period, is how do we make sure that vulnerable populations who are maybe even less connected than we are, who don't have access to social media platforms necessarily, or to other types of digital communication tools, are still receiving the information that they need that's actionable and context relevant for them. So just a quick introduction to Internews. Internews believes that information saves lives. In order to do that, we really work on helping to improve information ecosystems and environments within the areas we work. Our team particularly focuses on humanitarian context, so really helping to make sure that vulnerable populations or communities facing crisis are able to access actionable, context-relevant information to make decisions about their lives with. So in order to do that, we work on 5 elements of a healthy information environment. We really focus firstly on good information. So understanding when we enter an ecosystem, is there good information available that people can actually utilize and make choices with? We also then have to focus on safe access. So not only is there good information, but can people actually get to it? So that includes making sure that information is available on multiple different types of platforms, which means that we have to understand what types of platforms are utilized and trusted by the communities that we're trying to reach. Especially in this day and age, and I think because of the digital nature of information sharing for this response, we also have to really think about how busy the information environment is. So how can we help people better access good information that's actionable and relevant to them, and kind of cut through the incredible amounts of both good and bad information that are kind of flooding the information ecosystem right now. So safe access can mean quite a few different things depending upon the environment that you're working in. We also recognize that no matter how good of a job we do, we will never be we will always be one step behind the kind of mis and disinformation that's flooding the information environment right now. And so we do want to make sure that when we're working with local communities and local organizations, that we're also helping to build skills for critical assessment of information so that people can identify what information is good and what information is maybe less useful, shall we say. And so we really work on building those skills within the communities that we're working. Another area that we focus on is strong business models. So something that Internews always prioritizes is ensuring that we're working with local media organizations, local health and humanitarian organizations as much as possible, so that we're really fueling what makes a healthy information environment in a local context, which are local information providers. And lastly, but certainly not least, one thing that we really do, especially in humanitarian contexts, is ensure that we're building bridges between the communities that are suffering from the crisis or being affected by the crisis and the stakeholders that are serving them. So that makes sure that they have a voice, that the voice is being heard, that there's a platform for a diverse group of voices to be heard, and that we're then sharing that information back with health and humanitarian actors. So as you can imagine, some of that work has become a little bit more challenging since we're facing COVID. I think as most of us have experienced, we've all had to start working from our desks. And one of the biggest challenges that we've seen, of course, is that in order to understand an information environment or really any context, you need to be on the ground. You have to see what's not getting captured in surveys and in news and various other things. You need to be able to get close to communities that are maybe more invisible than others. And so switching and pivoting to remote work has been incredibly challenging to make sure that we are not missing people when we're trying to build our information response. And so this has really pushed us to make sure that we're working through our local partners, that we are working with partners that are reaching out to vulnerable communities who might not be in that digital landscape that we're all operating in now. And to really try to dig deeply with those groups to make sure that we are still trying to, we're still reaching vulnerable populations that we would otherwise try to if we were able to be there in person. Another big challenge that we're seeing is, of course, as everyone has pivoted to respond to COVID, other types of development and humanitarian work have come to a halt or have been severely interrupted by that, by the COVID response and by COVID itself. So we're seeing stressed health systems, which of course are affecting other types of health and nutrition activities. We're seeing a breakdown in education. So, we're going to have generation, a whole year of where children may or may not have had school. And we don't really have necessarily a good solution to that, for the year to come. We're also seeing huge economic upheaval. We're seeing increases in gender-based violence and other types of domestic violence. And in many of the humanitarian contexts that we're working, we see just crisis after crisis kind of compounding the stresses that populations are facing. And all of that kind of feeds into how vulnerable people are to mis and disinformation. If they're having to sift through multiple different types of information for multiple different challenges, how do I get food? How do I get medical help? How do I stay safe from COVID? That just really drops their or increases their vulnerability to being to mis and disinformation. So yeah, to the third point, we do see an increased risk due to misinformation. One of the challenges is that despite how poor an information environment is, people in crisis have to make decisions about their lives. And so they're going to do that with the information that's available to them. So again, really thinking about how can we help to cut through the noise and help people get access to trusted and verified information that's in their local language, that they understand, that's contextually relevant, that's actionable for them, that they also then have platforms with which to ask questions about that information that they've received, is incredibly important so that they are not having to make life-changing decisions based on an information poor source. And lastly, on a little bit more of a positive note, again, we have seen just this huge ability to partner with amazing local partners on the ground who have also done quite incredible work to pivot as well. And so the creativity that we've seen and just the incredible work that's being done has been a really exciting opportunity for us as well to really push working through local partners, working with local community members, and yeah, that's been the inspiring part of this response. So I'm really excited to hand over to Irene, who will kind of describe our Rooted in Trust program and the work we've been doing in relation to COVID, and then we'll hand over to Ellie and Abdul Mujeeb.
Great, thanks, Meghann. So I think one of the questions that we often get asked is why rumors? I think, rumors are incredibly powerful. They have the ability to cause confusion, to derail health programming, to cause instability in already very unstable environments where we're working, rumours are also really interesting in terms of what they can tell us about a community. They can point towards information gaps, and that might be a gap in perhaps an understanding of COVID-19, or perhaps a gap in understanding where they can access testing and treatment. They tell us a lot about trust, who people trust, who communities trust in terms of where they get their information, but also where they might be comfortable going for services. They can highlight some misunderstandings, and sometimes that comes from humanitarians ourselves, where we've tried to communicate and perhaps not done a great job or not been as clear as we thought, and we might have contributed to rumours ourselves. So it highlights where we might need to jump in and fix our own mistakes. Rumours also really can highlight social divide. So I think one thing that we've seen a lot of in this crisis is rumours really pointing towards prejudice towards migrant and refugee groups. And rumours do highlight those social divides that we might already have in our environment, but they can sometimes inflame them as well. Rumours are also a really great early warning mechanism. I think sometimes when people are looking at rumours in humanitarian crises, they look for the rumour that is the most common. And that's really important. It's really important to look for the most common rumours, but also to see rumours as that early warning mechanism, as something that if you find a piece of information that is very likely to be believed and has a very poor impact, perhaps might impact an individual or cause harm to a community, or perhaps to humanitarians themselves, to catch that rumour at an early stage and be able to respond is really important. So rumours are a great early warning mechanism as well. And of course, disinformation. Rumours also point towards people that might be trying to disrupt an environment or to gain out of a situation that's happening at the time. So at the moment, I'm working on a project which is called Rooted in Trust. As you can see there, we're working in 7 different countries around the world, 7 very different countries, but all places that have had an impact from COVID-19, but are also experiencing their own humanitarian crises at the same time. And what we're trying to do is look at local, regional, and global responses to rumours and misinformation surrounding COVID-19. So we're using rumour analysis to support improved risk communication. That's really key in our project, and also to support local media to make sure they have the tools they need to respond to some of the rumours that are circulating in their communities. It was really important for us not to come in as Internews and set up new information streams and new information channels for communities, but to look to where they already trust information, to look to trusted local media, for example, and other trusted information providers, and channel our efforts to support those information providers to have the tools that they need to do a great job. So with local media, for example, we're training, we're providing resources. Importantly, we're providing that scientific information translated into accessible formats and local languages. That's really key for media in this crisis, I think. And I think the focus of what we're trying to do is not simply identify a rumour and replace it with a fact. I think that's one thing that COVID has really taught us all, is that to defeat a rumour, we actually need much more than facts. What we need to do is take a step back and look at the bigger picture of the environment in which that rumour exists. So what is the environment that encourages that rumour to spread? What are perhaps the trust in perhaps health providers or government information that might mean that people are more likely to believe that rumour than if they were in another environment? Or what are some of the community fears and anxieties that might also encourage them to look towards these rumours as an answer to many of their questions? You know, it's definitely one of the challenges in this crisis, is that there are so many questions and there are so many grey areas. And that community anxiety is really quite a breeding ground for rumours. If we go on to the next slide, social media has definitely played a huge role in this crisis. I think we can all see how it has definitely allowed information to spread at an exponential speed around the world, good and bad information. And one of our key collection points for rumours in the Rooted in Trust project is social media. We're taking a qualitative approach. So what we're trying to do is to really map that social media ecosystem. So to understand the pages, the groups, and the forums where discussions are likely to happen, where COVID-19 might pop up. It might not be necessarily the most obvious place. It might not be a group called chats about COVID-19, but it might be those secondary pages like religious forums or discussion pages or groups about traditional medicine, where there's likely to be that overlap with COVID-19 and people are likely to be asking questions, perhaps have concerns about COVID-19 and the pandemic more generally. But of course, you can't only look at social media to understand a community's information needs. Social media, of course, doesn't include everyone. And it's really important when we are using it as a tool to look at rumors, to think about who does social media include? That's an important question, but also who does it leave behind? Of course, not everyone has access to social media. That's fairly obvious for everyone. But also social media doesn't do a great job all the time of amplifying those voices in society that already struggle to be heard. So it's really important to be very aware of that when you're thinking about where in the social media ecosystem you might be looking and listening for rumors. I think the other thing with social media is, of course, you can never truly see the full picture. I think we all know that the majority of discussions that happen on social media do happen in private forums. They might happen in, for example, WhatsApp chats between friends or even within larger groups, and they might be private messages between friends and family members as well. So we need to keep that in mind, that we're never seeing the full picture of discussions that are happening. We can only ever see that tip of the iceberg. And of course, to acknowledge that people use these platforms differently. Some platforms might be used by a more elite in the society. Some platforms might be preferred by older members of society. For example, in some locations where we're working, we're finding that voice messages are very popular rather than typing, to overcome issues of illiteracy, of course, and for using multiple languages. So all of these things are quite often missed in data scraping exercises, and it's really important to try and find ways to make sure that information is also captured in whatever system you might be using. And I think for us as well, because of course we can't only look at social media, just as we need to communicate risk using multiple platforms to try and make sure we reach the broadest audience we can, it's really important that we also listen in broad ways as well, open our ears as wide as we can. So with our project, for example, we might combine social media with community-based collection. So in Colombia and Mali, we're working with migrant and displaced populations there, with face-to-face collection happening with migrants and displaced community members themselves. We might do collection via community media partners. For example, in Philippines and Central African Republic, we're working with large networks of local media who are also funneling information to us. And of course, you know, it's really important for us as well to have those partnerships and coordination with other humanitarian partners to make sure that it's not only the information that we collect that we're analyzing, but we leave that door open to make sure we can have a much more also collecting rumor data to contribute to our analysis. And that's how we build a more comprehensive picture of the rumorverse, or at least as much as we can in these physically and socially distanced times. So I'm back to you, Meghann.
No.
Wonderful. Okay, well, I'm happy to pass over to my wonderful colleague, Ellie at Translators Without Borders, who will take us forward.
Okay, thank you. Okay, so thanks for that super interesting presentation of the Rooted in Trust project, which we're really happy to be joining in support of all of that work. But looking particularly at Afghanistan. Translators Without Borders believes that everyone has a right to access the information they want and to make themselves heard using the languages, the formats, the channels that they're most comfortable with. That has been a challenge in many ways in the COVID-19 response, which I think has really put a global spotlight on issues that we were already aware of, challenges that were already impeding two-way communication with vulnerable individuals. But languages can be barriers. They can also be a bridge across that social distance. And we know from our own experience that communicating with individuals, the most vulnerable individuals included, in the languages that they speak and understand, can unlock trust and confidence and agency and understanding. Typically, there are three big things standing in the way of listening to all affected people, and not just those who are most educated or speak the international languages. We did a survey back in May of some of our 100+ humanitarian partner organizations, surveying their field staff, program staff in particular, those working on risk communication and community engagement for COVID-19. And it was quite startling. We found that 1/4 of respondents felt that they themselves didn't have enough information about COVID-19. And when they were asked what further support or resources they needed in order to communicate to the communities they were serving, the most common answer was information materials in local languages. So we've been trying in our response to COVID-19 over the last, how many months is it now, to try to address some of those key obstacles. The first one that always comes up is that there is a lack of data on the languages that people speak and understand. It seems a no-brainer, but there isn't a single authoritative, up-to-date, open access, free to access, authoritative database on the languages of people around the world. And that's needed, of course, if we're going to communicate in the right languages, although there has been a fantastic rush to translate accurate material on COVID-19 and its treatment and its prevention in languages around the world. Nonetheless, if you look at it, the vast majority of public information on COVID-19 remains in the big international languages. And that's a real challenge, particularly for people who haven't had access to an education, or not so much of an education, or in many societies, those groups that will have less opportunity to mix with other communities. For instance, in some conservative societies, women will have those challenges. Very often people with disabilities will have those challenges. And in many societies, older people in particular will be less literate, have had less access to education, and therefore will be less comfortable either reading or accessing otherwise information in one of the dominant languages from their community. So we have been taking census data and other extant language data to map languages and literacy rates against the spread of the pandemic. So doing that, we've been able to see that some of the highest rates of growth in new cases of COVID-19 have been in linguistically diverse countries with low literacy rates, particularly low literacy rates among women, for instance, countries like Nepal. And that tells us that we need to shift our focus in communicating on COVID-19 from written information in more official or international or dominant languages to developing significantly more pictorial and audio and video content in the local languages that people are most comfortable with. So under Rooted in Trust, we're looking forward to working with Internews and other partners on developing language and radio maps for Afghanistan and Mali to help inform the communication strategies in local languages through the existing radio stations, which are generally, as we know, some of the most accessible and some of the most trusted information sources. I realize I've not been sharing my screen. That was the screen for that particular point. I beg your pardon. The second key barrier, and it affects everywhere, but it's been a particular challenge as we all learn the foreign language around the pandemic, is confusing jargon, often medicalized jargon, often quite dehumanizing jargon, talk about cases and mortality rates rather than about sick people and our loved ones dying. The confusing jargon around COVID-19 can be very difficult to communicate across languages. Try translating social distancing into any number of languages. And that creates misunderstandings. It can make it hard for people to know how to keep themselves and their loved ones safe. In the Rohingya refugee response in Bangladesh, for instance, where this picture is from, and where TWB has been working with IOM, among others, to get clear information out in the Rohingya language using loudspeakers on bikes, so to reach everybody. And to reach without text, to reach it for this predominantly oral language of Rohingya. We found in the camps of Cox's Bazar in Bangladesh that older women in particular were among the most deprived of information, of access to information about COVID-19 and how to prevent it. And a lot of that is to do with terminology. So for instance, the word for epidemic, there are two ways typically to say epidemic in the Rohingya language, but the older women that we surveyed, unlike the older men, consistently misunderstood it. They thought that it was a word for diarrhea. If that's your starting point for communication, then clearly you're not having the same conversation that you think you are. So under Rooted in Trust, we are going to be expanding our glossary. We have an existing glossary in over 30 languages of COVID-related and health-related terms, and we're going to be expanding that into a number of other languages for the countries that the project is covering. And a further challenge typically is very, very limited language support for smaller languages, not the big international languages. And that leads to a lack of access to timely information, both for affected people and for the health communicators on whom the burden of getting accurate, verified information out to counter misinformation very often falls. Since the start of the pandemic, as I was saying, COVID-19 information materials have largely been produced in majority languages, and where the translations do exist in other languages, in local languages, they can become quickly outdated as the situation changes, as the science evolves, or when advice and rules change on that basis. We have TWB calling on its amazing network of linguists around the world, working in 180 countries and over 200 languages, has been able to translate a quite amazing 5 million words or more into 100 languages so far since I think January of this year, to support accurate communication in local languages around COVID-19. But we've also been focusing in an era when, of course, remote, no contact communication becomes particularly important, on developing language technology to help people get answers to the questions they want. So we've developed a chatbot, and we've been enhancing it with language technology applications, which mean that people can engage in a really interactive conversation, and they can ask their own questions in their own words and get a reply in their own language. And of course, to do so remotely with less risk of disease transmission than with face-to-face communication. So at the moment, we're piloting and scaling up a multilingual chatbot with the Ministry of Health. That's what you can see on the screen, in DRC, currently in French and Lingala and Congolese Swahili. And we're planning to expand to other languages, other countries, and explore other uses for what we feel is really an urgent need right now to support particularly health and other outreach community level workers to provide the information in local languages that people need.
So listen, thank you very much for Meghann and all the panelists for that last discussion. It was really super interesting. And also the colleagues from Loop, Geoffrey and Salama at the beginning, have they managed to join us? Geoffrey, are you online? And our colleagues from Loop, have you managed to join us, Salama and?
Hi, I'm here, and Geoffrey, I can see him as well. And
excellent. I wanted to start with you both because you gave us a really good teaser on the platform you're using, and I'd love to just ask some questions in terms of you know, the partnerships that this platform might be opening up for you. Are you partnering with any governmental or international agencies? How is the development of the platform? How is it expanding your own network and possibilities?
Geoffrey, would you start with that?
Yeah, thank you. Yes, so we are starting out with pilots in a few countries, but the opportunities that this is opening out for us is possible partnerships with organizations that are in the aid sector and being able to use this platform to reach out to the beneficiaries who are receiving services from them, to be able to give feedback on their services. Yeah, so obviously we are getting into partnerships with government and also a lot of aid organizations in those particular countries.
And how is the the use of the technology by the community itself, by the community that you're engaging with? How is that helping to inspire you to develop further features or to develop it in other ways? Just asking because I think there's a lot of examples of how communities help to guide innovation by their use and by the needs that they identify. I was wondering if that's the case also with Loop.
Yeah, that's definitely the case. So what is happening is that people have different access to different technologies in different countries. So there is a need to try to adapt to the technology that is available in those particular countries. So there is people who have access to to smartphones, to internet, but also like a big number of people who have no access to smartphones or to internet, and they use like normal phones. So what we are looking to do in the future, which hasn't been implemented yet in the platform, but want to be able to use USSD codes so that people are able to give feedback using the technology that they have. But not only that, but also to receive back feedback in the same platforms that they have, because I think technology shouldn't be a barrier to for people to give feedback. So what we're trying to do is to also try and level out the playing field so that it's bottom up and people are engaged in giving feedback in the aid that they receive, so that because they're the recipients, and this is key because if their interests are not put at the center of the design of the aid mechanisms, then a lot will be lost out in the process.
Right, and there was quite a lot of discussion in the panel that just concluded with Meghann and her colleagues on the issue of rumors and misinformation. Have you any hands-on experience of managing that with Loop?
Yeah, so that's very key, because always there is a lot of information. What needs to be done is to put such kinds of rumors in an open way so that other people can also react to them. Because for one person, it might be like an opinion which grows into a rumor, but for people to be able to interact with that kind of information and comment on it, you'll find that what was false information is debunked right away in real time. So before the information goes ahead and causes more harm, it is debunked right away. So it's very important for such information to be like feedback to be given in an open way, so that the information, other people can also react and give feedback on it. I don't know if my colleague Salama has something to add on that.
Maybe just linking to the previous session, it's the different language that we're using. So even what comes in, which could be rumors from a specific perspective, it's still an opinion for someone else. So it's just making sure that in developing our platform and in the way information is put up, is that we do no harm, basically, not only for the service users, but also for the organizations that are providing aid within that locality. So that's why everything that will come through Loop platform will go through a moderator, basically, and then that's when it's looked at what can be put in publicly, which is mostly everything. But then if it's something that can do harm, then that's dealt with offline, basically, and maybe just with that organization. And just going back to the point of partners, we are looking, as Geoffrey said, we within the humanitarian sectors, of course, as being our main partners, but then for us, it's people who are receiving the aid who would be kind of the key partner for Loop, because we are seeing them as part of developing this tool and not only recipients.
Right. If I can expand that topic on partnerships, because Meghann, you also mentioned that local partner network is very much part of how Internews operates. And I guess the time that we're living in now with COVID-19, it's a massive opportunity to deepen that partnership network and further empower partners. Can you just tell us a little bit how you're working with partners and how that really brings value to the mission of Internews?
Yeah, definitely. So I mean, at the center of Internews's mission is working with local partners, because we believe, of course, that they know their context the best, they know their communities the best, and so they're also the most trusted generally. And so we're able to make sure that they are empowering the communities with accurate information, and that we're helping them to best leverage their knowledge and skills, because yeah, the local context is key to understanding why and how an informational message will be shared or received and trusted. And again, we drop in and out of a crisis. The partners are there forever with those communities, and so that's really making sure that we build sustainable information responses as well. So we go in, we can help with training, we can help to make business models more sustainable. Help to make sure communities and partners understand how to leverage tools like social media, and then hopefully those skills continue past the time that we're there. So it's really important to be working with those local partners, and from the beginning designing with the community in mind, because yeah, we're not there forever.
Okay, I have, if you see me looking at my phone, it's not because I'm disinterested. It is our good colleague, Fanman, is sending in questions that are being curated from the platform. So thank you everybody for your questions. And Irene, I have one for you, which I think is, it cuts right to the issue, right? And it's around trust, information and trust. And the question is, why communities and national-based agencies should trust international agencies and should see them as a trusted provider of information, given that many of them have associations with international governments or donors, and maybe don't have the appetite or the understanding that the information on the truth of the information.
Yeah, I think that's a really challenging question for sure. I think perhaps it's less a question of why local organizations should trust international organizations. I think it's more a question for the international organizations of coming into an environment, as Meghann was saying, and saying, how can we support the existing organizations that are here to make sure they have the tools that they need to respond to these questions? I don't think all of the answers necessarily come from international organizations. Certainly with Internews, we have great access to the science. We're able to translate that into local languages and package it in a way that is perhaps easier and more accessible for people to read and to use in their own communication efforts. But I think, especially when you're looking at rumors, a lot of the answers to rumors that pop up in a pandemic, they're not all questions specifically about science, and a lot of the rumors might relate to very close local issues. And for those kinds of local rumors and local issues that might be circulating, that's where it's really important to make sure that those local organizations are supported to know how they can respond to those questions, but also that how they can support their community as well to have that critical thinking, to know that they perhaps should take a beat, take care before they share the information, and how to recognize information that maybe half-truths. I think a lot of the rumors that we're dealing with in this crisis, some are of course entirely false, but the most successful rumors that you find are half-truths. They're the rumors that make people think, well, perhaps that's true. And I think really the role of international organizations there is not to come in and say, we are the ones with the information and you must trust us and you must follow our advice. It's about guiding those local organizations and finding out how we can best support them to do the job that they need to do to support their community.
So,
I hope that answers the question.
I think absolutely it does. Yeah, it's a very complex issue. I mean, rumor itself and misinformation can come in many different guises. It can be accidental, it can be related to gossip, or it can be part of a concerted campaign to change attitudes and behaviors, and it becomes all the more complex to deal with and to tackle. And I know that there's a lot of great studies being done by CDAC and the Red Cross, Red Crescent and others on this topic. But I mean, even since those studies were done, this issue of misinformation and trusted sources has really, it's really become a very topical, current, prescient issue of concern right across the globe, where we see a lot of sources being undermined that would have been traditional sources of mediated, objective reporting, and so forth. So really, the question I'd like to put to maybe starting with Meghann, but opening up to the entire panel, because I think it really is a key issue. Are humanitarian organizations and civil society organizations, are they really equipped to take on concerted misinformation campaigns? And like how can they really try to turn a situation when there is deliberate efforts to misinform communities? Meghann, if I could start with you.
$1 million question. Yeah, I mean, I think this is probably one of the largest and newer threats that we're seeing emerge, and we have been seeing it emerge over the last several years, where it's not just misinformation. It's not just people accidentally spreading rumors or information that might not be true. We're seeing actual disinformation campaigns where information is being politicized and it's being utilized against humanitarian actors and against civil society organizations or against certain groups of people. Which of course isn't new. Propaganda has existed forever, but it's now spreading at a scale that's beyond anything we could ever respond to, kind of rumor by rumor by rumor.
It's a scale, and it's personalized as well. I mean, the granular targeting of different personas, communities, etc., is now possible at scale as well, which is even more concerning.
Yes, exactly. And you see social media platforms being manipulated to create echo chambers where people are only seeing certain types of information and they're kind of going farther and farther down those rabbit holes. So it's more and more difficult to reach people with diverse types of information. So they're really only seeing one stream of information, which of course is solidifying opinions even more. And potentially increasing conflict. So I think something to be aware of as general humanitarian actors is that we don't, we're not specialists in information necessarily. Not every humanitarian actor is. And so it's really important to partner with organizations that do specialize in information. So working with people like Internews, with people like Translators Without Borders, with local media organizations who are starting to really dig into this challenge. So that number one, humanitarian organizations can protect themselves and their communities that they're serving from this type of threat, but also so that we can start to help build in those critical assessment tools that are so important for communities, so that we're not constantly fighting that one rumor, or that, we're not fighting this rumor by rumor. We're able to start building in an ability and a resilience within our communities to better understand how to sift through the good and the bad information, and how to question the information that they're receiving, and how not to respond right away and share some post that they emotionally react to instantly. So it's really thinking about what are those kind of resiliency tools that we can build into the communities we're serving, so that they can be empowered to get the good information themselves to the best degree possible. And then on the other side, it's really important to be advocating with governments, with stakeholders internationally, to start improving those information environments as well, so that we're not just trying to stick fingers in the dam where every information event happens. We're trying to think about at a policy level, how can we start to improve this too, which is a giant nut to crack.
How about initiatives like digital literacy training to empower communities to navigate the complex and fast changing social media ecosystem and digital ecosystem in terms of misinformation and disinformation. Is that something that's being practiced as part of being mainstreamed into the type of information responses from Internews and other organizations?
Yeah, definitely. I think, digital literacy is a hugely important area that we need to be working on whenever we're starting to introduce information via digital tools. So we have to make sure that we're providing, again, vulnerable communities with the skills and knowledge to understand how to use these new tools that they're getting introduced to. I think particularly as we see communities that have been on the other side of the digital divide start to cross into the digital world, where they're running their businesses digitally, they're getting their money digitally. All of these things require skills to understand how to do it safely. And so, Internews can work on that, but I think also just general humanitarian organizations also need to be building in digital literacy, courses and informational sessions to their work so that they are also educating people on how to use these tools, particularly as we see aid responses shifting to digital tools with accountability mechanisms moving to social media or to apps. We want to be empowering people with those skills. But I think alternatively, it's also really important for us to not place the responsibility entirely on the community to understand how to get good information. We also need to be working on the systems to make sure that there's good information to be had. And so that's really important as well. It's not everybody's responsibility to, obviously they need to be educated on how to find good information, but we need to make sure there's good information available as well.
In order to, coming back to this question, because I see several of them are coming in on this topic, and maybe if I bring in Ellie, there's a number of issues to touch on. I think it really centers around the trust and being the wanting to be seen as a trusted arbiter of information, whether it's public health information or the information that typically surrounds an emergency operation in a disaster affected area, for instance, and that this assumption of trust is really very closely tied to the credibility of the organizations themselves. So we're relying then very much on the reputation of organizations to address these issues of mis and disinformation, because we're relying on being perceived as credible. Do we have evidence of this credibility, or is that something we really need to focus a lot more on in terms of being humanitarian actors in complex and sensitive environments? I can ask you first, Ellie, and of course anybody can join in.
Yeah, I think that's definitely a tricky one. I don't know is the answer to the question of do we have enough evidence about our credibility. I think certainly I've seen some studies suggesting that in some locations there is trust in humanitarians as a source of information, for instance, about COVID-19. But a lot of the weight falls on people at the community level, so that the staff of humanitarian organizations and of the community health workers working for local health authorities, who are having to take a fast-track course right now in epidemiology and infodemiology. Sorry, I can't turn my video on because it's been blocked. Okay. I think we really do, following on what Meghann was saying a bit earlier about building capacity, we need to support those individuals to have the information, to have the understanding, to be able to answer people's questions, community members' questions, confidently, accurately, consistently, and using local languages and the local concepts around health that people are familiar with. We've seen in many cases, and particularly I'm thinking back to research that TWB did around the last Ebola outbreak in DRC, that often community health workers are not equipped for that. They're trained in a national language. They're provided with information resources in a national language, and they're not themselves health experts. Often community health workers, depends on the context, but they're not necessarily someone who's had primary education or much beyond primary education. Their own health literacy may not be high. And I think we're beginning to see from studies around vaccine confidence, for instance, that in many contexts, community health workers themselves are hesitant about vaccination. So looking ahead to hopefully a COVID-19 vaccine sometime in the coming months, we need to be preparing for that as a sector as well. We need to be supporting community health workers, other outreach workers, our own teams, to have access to the information, to get their own questions answered about vaccination, about other COVID-related content, so that they can feel comfortable. Certainly, I'm hearing from colleagues in the field. It's awkward. I'm not a health expert myself. How can I present myself as an authority on this to the community? So having access to resources that people themselves can turn to check their facts, to make sure that they're accurately answering the question, I think is a way of helping to build that credibility and that essential component of trust, which we're going to need very much if we do want a sufficient proportion of the community to accept vaccinations when they are available.
Yeah, I think maybe for you, Salama, like in discussing this issue of credibility, do you think there's a need for organizations to better acknowledge their own challenges, the challenges in the sector, particularly around issues like accountability and localization? And maybe going back to what Ellie said there as well, maybe that sort of misplaced belief that you need to be an authority on everything and you need to provide an answer to everything. Maybe there's more room to communicate the limitations.
Definitely. I think we wouldn't see much progress if we don't start with that. Like, we are asking communities to trust us when it comes to critical things like health, COVID as an example, while we ourselves in some instances are not acknowledging our own issues. We are the only sector that, when it comes to information, we are the ones who analyze the needs, provide the aid, monitor the aid, report on the aid, and decide what works and what doesn't work. So we definitely need to kind of redefine what does accountability mean within this sector, and start talking about our own issues and challenges if we want the communities to actually trust us moving forward. And also going to that, when it comes to data and information, the power of who have that information and gets to analyze it and then present it to the public, we have to shift that power and make sure that we have a way of actually sharing the data as it is with the communities and with local actors and local structures, and then giving them that chance to actually analyze it in a way that more fits them.
But at some stage, will that data already be, filtered with certain analytical requirements based on the operation at hand, or of course, anonymizing the data, etc.? There will already be some decisions taken. I mean, are there ways around that to really make it as participatory and inclusive as possible without filtering the data, without bringing that sort of subjective filter to the data already?
That's what we hope we will be able to do with Loop platform, and with maybe working within the sector to develop other things that are similar. It is the fact that the data or the information is presented and is available open as it is, and then it's up to the person who's actually receiving it to be able to analyze it in a way that is actually makes more sense to that individual or to that group of people. It's not the only way forward, but then it's that transparency that we're hoping will bring back part of that credibility, and saying that this is what it is and this is what people are saying, and then it's up to the maybe international community to take it and analyze it in a specific way, but then also locally people can take it and analyze it or have other meanings added to it, because locally it could make more sense in that way.
Geoffrey, a couple of questions coming in here around localization, and some of them, most of them, many of them touch on the issue of investment in localization. Are organizations really investing proportionately and enough in localization to really prioritize and have more impact when it comes to local dialogue? What's your experience of that? What's your feeling on that, and what's your advice on that?
Yeah, thank you. I think when it comes to localization, still it is a bit one-sided, where still the organizations are the ones that decide up to what level they're going to localize. So that there is, I think, need to focus on the people, on the local people, and try to put the power in their hands. So I think deliberately organizations, they mostly focus on the donor who is providing the money, without focusing on the people who are the beneficiaries of their services. So yeah, it should be like when designing these tools to use, it should be community and people centered. Like the people should be part of the design of the localization process. So they should be encouraged to provide feedback on the tools that are being used, and also what issues are key and are important for them. So they should be the ones to decide what works for them and what doesn't. What happens, I think, in most cases is that most of the localization is filtered just to benefit the reports that the organizations want to show to the donor, without focusing on the what the community interests are. So I think trying to do it like in a transparent and more open way would be the solution. So however much we talk about localization without making the process open and making local people involved, I don't think it would be enough.
And then just to extend that issue as well, I mean, we've talked a lot today and in this session around the need for digital literacy, but what about data literacy and data governance? One of the attendees is emphasizing that, in COVID-19, this pandemic that we're all experiencing globally, never have they heard so many wrong and repeated statements using data, or data being misused and misinterpreted, misunderstood. And this is a question I'd like to share with the panel, starting with you, Geoffrey. What would be your, based on your experience, what would you like to see put in place for really good data governance and data literacy?
Yeah, that's very very important. I think we are in the age where there is too much information and data out there. In the past, like, there were only a few streams of information. People had to rely like on the local newspaper, on the radio station to provide them information. But we are in the age where there's all these kinds of digital tools and social media. And all this kind of information trickling in. But also we are seeing, situations where data is being politicized, where the government will, for example, give out information that they call it official, but with a hidden political agenda. So I think it is really key and very important to make sure that in terms of data governance, people should also be involved in trying to make sure the data is trustworthy and doesn't get misused. Because we have seen very many examples of that. So giving people like the opportunity to be able to give feedback to the information that is shared in a public and transparent way, however much the source of the information is, helps to to help people to react to information that is being put out there. So they're the ones who will decide whether it is correct information or not, depending on their reactions. And I think what is important is to make it timely and quick, so that before the information is being misused and yeah, the people can react to it and try to solve the situation before it escalates to another level.
We're coming up to, with 5 minutes or so left in the panel, but Meghann, I'd like to extend that question to you, if I could, around the issue of data governance and the perspective from Internews, particularly, in the frame of the topic that we're discussing right now, which is really engaging and supporting the most vulnerable at a time of social distance. How can we do that effectively? How can that be done effectively, while also ensuring that there's good data literacy and data governance in play?
Yeah, and I might hand over to Irene as well to respond to this. But this is something that we've been focusing on incredibly, because like we have journalists now being thrown into this huge pool of data that's hugely scientific, hugely technical data around health data. And so they're having to interpret that, and then they're having to share that with populations, again, oftentimes in multiple different languages. And so something that we're working with is we've identified a panel of kind of health advisors that we're able to then share and work with our local journalistic partners, so they can teach them how to interpret health data, where to go for good sources of data, and how to respond to questions that they may receive. And so we, again, are really trying to help local journalists understand where do they go for good verified information, and then how do you properly and appropriately report on that data that's been received. I think going back to Ellie's point earlier, very often we're working in communities where you have to take incredibly technical language and also then translate it into not only the local language, but also make it simple to understand. So try not to use jargon, try not to use hugely technical terms. And so again, that requires a level of translation. And so we work also with our local partners on that as well. Irene, do you want to speak to that at all?
I can speak to it really briefly, yeah, of course, because I know that we're starting to run out of time. But I mean, one of my favorite quotes are that there are 3 types of lies. There's lies, damned lies, and statistics. And I think that's definitely one of the challenges that we have in this crisis, is that there are a lot of numbers flying around, as Meghann said, and journalists do need to be able to interpret them, but they also need to be able to play their traditional role of holding power to account. And sometimes that means looking at the statistics that have been used by those in power, perhaps to represent perhaps what the COVID impact might be in their location, and to know how to look at that source data and interpret it to see if that analysis that's being provided to them and to their community is accurate and is trustworthy. I mean, another key part of the project as well, of course, is preparing journalists for this next stage. So for this next stage where we're about to have perhaps a number of vaccines released onto the market, but helping journalists to also understand things like the vaccine production process, how to look at something like a clinical trial and to critically analyze whether this trial is worth lines in your newspaper or worth time on your radio station, whether it has a large enough sample size to make it worthwhile telling your audience about. And it's that kind of core building block work that I think is really important to be able to support the community to get that information that it needs at this time, and to try and interpret all of this data that is flying around at the moment, to make it palatable and accessible.
Thanks, Ellie. I know in Translators Without Borders, you're looking at a way of using language technology to automate some of the analysis from data gathering. Would you like to share with us something on that before we wrap up the panel? And I'll do a quick tour of everybody before we close, but I'd be very interested to hear what's happening with TWB on this particular issue.
Sure, thank you. Yeah, I mean, as a sector, we're very bad at listening to people who are not speaking to us in English or in other international languages. Every year, probably terabytes of data are thrown away because we don't know how to analyze it, we don't know how to manage it if it's not in one of those languages. So, for instance, we've been working together with IFRC on the answers to some of their open-ended questions on COVID community perception surveys, which they've undertaken in something like a dozen languages in the Asia Pacific region, for instance. There are ways of using the tools that are out there to automate categorization and enable that to be used. Another piece that we're working on is developing automated transcription for marginalized languages, so that organizations can take audio recordings of people's full answers to questions, and not simply a checkbox or a drop-down menu answer on an automated survey tool. And thus get at the real richness of what people think, what their priorities are, what their needs are, and in relation to this pandemic, what they believe, what their fears are, and what information they're asking for.
And any final thoughts for the attendees today on the digital ecosystem, or on being more effective on delivering for the most vulnerable during times of social distance?
I think there is a lot that we can do with technology, and we need to make use of every tool at our disposal to do that. But we also very much need to use it to listen to community members on their actual concerns. I think that's how we're best going to combat misinformation and disinformation, is by supporting community workers like community health workers to develop trust and credibility through having the answers themselves to people's actual questions, and being supported to answer them in the languages and the formats that people are going to be most comfortable with.
Excellent, very good. Salama, any final thoughts from your side?
Just maybe that we need to keep reminding ourselves that people have to be at the center of this. We talk about digital, about changes, about what the future needs to look like, but then it's the people who we are supporting or we're helping or we're working with who need to be at the center of this when it comes to work. And we just keep reminding ourselves that the ultimate goal is to shift the power and make sure that it sits with them, not with us.
It's not about the technology either, it's about the people, right? That's always been the case, I think. Yeah. Geoffrey, have you any final thoughts for the panel?
Yeah, I just want to mention that, I think we have to agree that everyone has an opinion about the humanitarian sector. So they have a contribution to make, however small it can be. So we need to acknowledge that and make sure that their voices are heard, and put avenues in place for them to be able to be heard, so that we can have better services as a result.
Excellent. And Irene?
Yeah, I think my closing thoughts would just be is that it's just so important to listen and to continue listening, to not look at purely top-down messages that we're creating in our offices in Geneva or New York, or I'm in Melbourne, wherever you happen to be, to actually respond to people's real questions and concerns, because that's how you build trust, and that's how we ultimately give people the information that they need. And I think in terms of vulnerable communities, it's about remembering that their information needs might be different to other sectors in the community. So making sure that we do really make an extra effort to make sure that we're listening to them and listening to what they need and responding to that.
Very good. So truly designing our programs based on what communities are telling us, and finding ways to really listen properly and effectively. Meghann, maybe I'll leave the final word to you for the plenary discussion.
Thanks. I mean, I really just echo what everybody has already said. I mean, I think we really want to be listening to people. We really want to be making sure that we're leading adaptive programs that when we get feedback and responses, we're responding to with actionable information that actually respond to people's questions and needs. And then again, we're working through local partners and with local communities as much as possible, and keeping them at the center of our responses and in the leadership of our responses, so that they're they're really empowered and they have the skills required to carry their communities forward into recovery after this passes. Thanks, everyone.
Excellent. Thank you very much. So really, thank you all very, very much for your time and thoughts and contributions. Lots to consider there around improving how we facilitate participation, how we facilitate trusted information, and work with communities to really to really add value to addressing a lot of those challenges. And of course, the importance of listening, the role of technology in enabling us to do that, but also to do it at scale and to do it in a very sensitive way. So we've come to the end of session 2, the digital ecosystem, this afternoon. We're going to take a short break now for 30 minutes. We'll be back at 4 p.m. UK time, so that's 28 minutes exactly from now. We'll be coming back with a really good session. It's the final session of the day. I really encourage you to rejoin us at 4 p.m. It's a digital brainstorm, quite provocatively titled, No, You Don't Need a Nap for This, Why the Accountability Puzzle Will Not Be Solved by Digital Fixes. And I'm sure there will be some very strong opinions shared and hopefully some very good ideas and solutions shared there. That panel, our digital brainstorm session, will be moderated by Arathi Krishnan, who's the author of the background paper to the CDAC Public Forum, and should be joined by a number of colleagues, including Meg Sattler, Director of Ground Truth Solutions, Max Morel from Fondation Hirondelle, Roya Pakzad, the founder of Taraz, and myself. My moderator role will be changing into a panelist, so the gloves will be off. I'm looking forward to that in 30 minutes time. See you all then. Thank you so much for your attention till now.